Okay, so a very good question was asked by one of the members that when we should give or when we can give low molecular weight heparin or for that matter heparin in DIC, disseminated intravascular coagulation. So understand that you may feel that DIC per se is a condition where there is a lot of bleeding and we tend to give fresh frozen plasma so that there is no active bleeding or we should stop the bleeding per se. So why we should give anticoagulants like heparin in DIC? So understand that this is a very logical question. DIC per se, by the term you understand, disseminated intravascular coagulation. There is a lot of coagulation, lot of thrombotic events happening in the blood vasculature, and it happens in an enormous form. That's why the coagulation factors are consumed, and the platelets are also consumed. That's why there comes a deficiency. That's why you have thrombocytopenia and coagulation factor deficiency, and the patient tends to bleed profusely. So the treatment per se is given with the fresh frozen plasma and correcting the cause which has caused DIC. But contrary to that, because primarily it is a thrombotic thing which is happening, lot of thrombosis happening in the patient's body. That's why it's logical to feel that whether we should give low molecular weight heparin this patient or heparin this patient to prevent the thrombosis. So earlier, earlier, I read somewhere, I'm not remembering the book exactly, but it was mentioned that if the platelets are more than 30,000, we can give low molecular weight heparin or heparin in such patient to prevent the thrombosis. But the recent literature, the recent books, even RIPI or up to date, anyway, I have read that heparin in DIC is only reserved for patient in which you have signs of thrombotic event, like DVT is there or pulmonary embolism is there or whatever, any thrombotic event. If it is documented, you feel that this patient has developed thrombus, only in such patients we should give low molecular weight heparin or that for that matter anticoagulant in such patient. Otherwise, other than that, no routine use of low molecular weight heparin or heparin is indicated in DIC patient as of the current consensus per se. So thank you for asking this good question. Do read more about it.